When you're a parent juggling work and family, the last thing you should have to worry about is how to afford your child's healthcare. Medicaid is a critical part of the safety net that helps families breathe a little easier. I'm Doug Strane, a research scientist at Policy Lab focused on the health insurance landscape for families. Today, we're talking about how Medicaid is more important than ever for working families. And if you want to really get in the weeds with me about this, I wrote a whole blog post that you can find at the Policy Lab website. While nearly half of all children in the US get their health insurance through employer-sponsored plans, costs for these plans have steadily crept upwards year after year. This includes rising costs of premiums and deductibles, which is the amount of money that you have to spend out of pocket before insurance starts paying for care. These changes are making it increasingly difficult for many families to afford coverage from private insurance plans, even if they have access to this type of coverage through their employer. For these families, Medicaid and its partner program, CHIP as we call it, offers comprehensive coverage at no or low cost for children who might otherwise be left without the care they need. Medicaid has been an essential source of coverage for low-income families for decades, and of course, this remains true. But as the cost of private insurance continues to climb, our research has shown that families that we would generally consider to be more middle income are relying on Medicaid for their children. This was especially true when parents worked for small businesses, where the offer of health insurance isn't a given. But it's not just those families. Our research also found that even parents who work for large companies were still choosing public insurance increasingly when they had that as an option. Given the growing cost of private health insurance, the importance of Medicaid and CHIP for these working families is clear. Medicaid's pediatric benefits are designed to meet the unique health needs of children, from preventive care to specialized treatment. Our research shows that children with Medicaid are less likely to be underinsured and more likely to get the care they need without the burden of high out-of-pocket costs. So let's cut to the chase. Medicaid is at risk. Proposed cuts could leave millions of working families without access to this essential support. We need to protect Medicaid and ensure that families continue to get the care they need to thrive, because when families are supported, we all benefit.